specifically defence spending, and whether you think that this money, 2.5% of GDP, tens of billions of extra pounds of money, your money, public spending, taxpayers' money, should go to the defence budget. Now, there's some people say, yeah, that's a great thing, we should do that, that's really important, our armed services have been underfunded for such a long time. Barry's been in touch. He said, I would scrap the nuclear deterrent shelter under the US deterrent umbrella and spend every penny on conventional weapons, swamp the air with drones, missile artillery and a missile defence system for the British Isles, says Barry in Newton Ards in Northern Ireland. Another person says, stop throwing money at the NHS, get the efficiency back and reduce the levels of management, utilising the existing fortune we spend on frontline services and put people in charge who know how to negotiate and run businesses. Well, let's talk to two experts on this. Simon Diggins is a defence analyst, and he is someone with a very distinguished military record. Matthew Hulbert is with us as well. He's a Liberal Democrat activist who knows the NHS very well because of his personal experience. Gentlemen, thank you very much indeed for coming on to the programme. Simon, what do you think the case is for this huge amount of military spending? We're in a cost of living crisis. Taxes are the highest they've been as a proportion of what the country makes since the Second World War. And lots of people will say, well, hold on a second, where does this money come from? That's maybe a side argument, actually, which we'll maybe get into. But from your perspective, why does the military need more money?
Because at the moment we face a threat which is faced directly at the moment by Ukraine. Some of our allies in the Baltic, Poland, are now seeing that Russia is posing a threat to them. They warn of potential for Putin to launch a war against us within 3 to 5 years. That's just in Europe. In other countries, other parts of the world, our interests are also threatened. We've seen a strategic rivalry with China, and we've also seen the issues around the Middle East. And without getting involved in the sort of Israel, Hamas-Palestine issue directly, nonetheless, we still have strong interests in those areas. And unfortunately, over many, many years, it's now really over decades, really since 1990, the amount of money we've been spending on defence has been reduced and reduced and reduced, to the point now where we have the smallest army we've ever had, certainly since the Napoleonic Wars. We can't recruit. Strategic nuclear deterrent doesn't work, not demonstrably so anyway. We don't have anything like the kind of air defence that even Israel has, this Iron Dome system, or Ukraine has in Kharkiv. In other words, we've allowed ourselves to get to the point now whereby we not only can't defend ourselves, we can't actually protect our interests or those of our allies as well. And for that reason, I welcome what Rishi Sunak has said. I have to also be very clear with you. I believe it to be just the very much start of what we need to be spending. We need to be spending considerably more. And I think sometimes the conversation around targets and money is not necessarily what we need to do. We should actually be saying to us, what do we actually need to have? And then prepare ourselves to spend those sorts of money. So that's where I am on the defence side.
So this is just the start of the level of money that we need. Matthew Hulbert, what do you make of that argument?
Good morning to yourself and your guests, and of course to your viewers and listeners. Well, I absolutely bow to Simon's knowledge on defence. Obviously, I can't speak to that, but what I can speak to is a broken NHS, to a system that clearly isn't working, to a system that has let down countless families, including my own. Some of your viewers and listeners will remember, Peter, that in 2022, my mum waited 11 hours for an ambulance after a fall at home, and she died 2 days later in hospital after an infection turned to sepsis. And that's just one of, sadly, all too many stories of people, of families who have been let down by an NHS, which I would certainly argue has been let down itself by 10 plus years of underfunding, of privatisation, and of mismanagement.
Well, on that note, so Matthew, let me just probe that point a little bit, because I mean, you say underfunding. When the Conservatives came to power in 2010, the NHS got £139 billion a year. Now, 14 years later, it gets £180 billion a year. Is that definitely underfunding? I mean, there are many public services that would love to have such a huge increase in spending. Clearly, I know you wouldn't necessarily disagree that reform and better management and other aspects are part of it, but I mean, the money aspect, is that not there? Why do people always say that it's underfunded?
I'm afraid it is. You just have to look at the European average. We're way below the funding spent in places like France and Germany on health spending. In fact, it would take something like an extra £40 billion per year for us to reach the European average on health spending. And I'm involved in a campaign group called Just Treatment, and that is what we're calling for. We're calling for £2 billion of immediate extra funding for the NHS, and then to rise by next year, actually by 2025, to an extra £40 billion, because the system just isn't working. And so in terms of competing priorities, I of course understand that this is a difficult world, a harsh world at the moment, a world where there's plenty of trouble spots. But I would argue that the money is better spent on the NHS.
And certainly to govern is to choose, and that's the point. We can't spend money and we can't give all the money that we want. And Simon, I'm sure you, like me, have complete sympathy for Matthew in terms of what he said. And I suppose your argument, Simon, I don't want to put words in your mouth, but your argument is not essentially let's take it away from other public services, but you do think that it is right to prioritise the Army, the Navy, the RAF, the Marines and so on, because the defence of the realm is just the most important aspect of what our country does, I would imagine, is your argument, Simon.
No, I mean, absolutely. And you're quite right. To govern is to choose, and prioritisation is hard. Firstly, if I may just reinforce what you just said to Matthew, and first I salute Matthew, your courage and actually telling a personal story as part of what you're trying to do. That's always very hard, and well done for doing that. I also recognise that if you do choose to prioritise on say defence, there are opportunity costs for that, unless we're prepared to increase our tax take from that. I will just give you one very quick counter to this. I've actually spent 5 years in the health service myself, working in children and adolescent mental health service in South East London.
I didn't know that, Simon. My goodness, what a revelation! Wow.
Yeah, I did. And if I may just say to Matthew that while there are areas where money is more important than anything else, my personal priorities would be around reform. I mean, the amount of money we do spend on health is massive. There's also a huge issue around things like social care, particularly care of the elderly. And I think in those areas, we'd agree massively around that. I'm not absolutely convinced in my own mind that throwing more money at the problem is the answer, to which I also reply exactly the same issue around defence. I mean, not only have we got a defence system that doesn't work for us properly in terms of what we need, our defence industry and our defence procurement system does not help us at all. You know, we spend a huge amount of money, and there are reports after reports from the National Audit Office and from politicians, House of Commons Defence Committee particularly active in this area, about the way in which our procurement system is not working for our benefits. So I think in both areas, you know, here we might have a point of agreement, both defence and health. The key to reform is not necessarily more money. There will be areas where more money needs to be spent, but actually what you also need to do is look at those management, those organisation and reform issues around it, because otherwise we'll be taking good money from taxpayers who are under massive pressure. We're all in the same position, and actually the money will not achieve the effect we wanted to achieve. A better health service, looking after people who need caring, like Matthew's mother, stuck in A&E for over 11 hours, or our forces who might find themselves fighting an enemy who is already, and this is the key thing for me, why I think, you know, if I made the priority, Putin is on a war footing. 8%, which is about the same amount of interest we spend on our defence, but 8% of Russia's GDP is currently being spent on its military. 1/3 of all government expenditure in Russia is on its military. It's fighting a war in Ukraine, absolutely, but actually what it's doing is reorganising itself to be able to launch more adventures in 3 to 5 years. So it's a tough call at the moment, and the guns versus butter argument was where it's put in the 1930s. But where I am at the moment is absolutely recognising what Matthew said and supporting everything he says in terms of reform and change, but saying we as a country need to prioritise defence. Whether we do that by taking away from other people, or whether we actually bite the bullet and pay more in taxes, I think is another argument for another day.
Well, maybe I can put that to Matthew, perhaps, because we just on that point, Steph has been in touch on WhatsApp and says, Peter, the NHS is not underfunded. There is simply too much waste within the NHS. That also goes for defence and educational services. They all need reform. So is reform the answer? Is rising taxes? I mean, if you want another 40 billion for the NHS, Matthew, you're going to have to say to some pretty hard up people, well, actually, you've got to pay more tax. I mean, that is what any new government would have to say, is it not, Matthew?
Well, what I'd argue is that those with the broadest shoulders should bear the biggest burden, that we should have a more progressive tax system, which taxes those that have been very fortunate in their lives just a wee bit more to pay for public services. I mean, I have a great deal of sympathy for a lot of what Simon says, and especially in regard to the issue of social care, because one of the problems, excuse me, that my mum faced was that ambulances were backed up outside the local hospital. The reason they were backed up outside the local hospital is because there were patients inside who were well enough to come home, but who couldn't come home because there wasn't care for them either at home or in the community. I mean, what I'd say is government should be able to walk and chew gum at the same time. I think actually that it shouldn't necessarily be a choice between these two things, and indeed other competing priorities too. I mean, for example, Peter won't be surprised to hear me say this. I think, let's scrap this dreadful, immoral and unworkable Rwanda scheme. Let's claw that money back.
That's a whole other argument, Matthew, which we did a little bit earlier, but absolutely fine to make that point. And sorry to cut you off, but I just want to put one more thought to you before we end this from one of our texters who says, Matthew wants to put more money into the NHS black hole. More money now than ever goes into the NHS, and it's not the amount of money going in, it's how they spend it. It's ridiculous to say put money there before our defence. Without national security, we will be open and vulnerable. Defence should be top of the list. Just briefly, your reaction, Matthew.
Well, what I'd say is that actually keeping people well is part of our national defence. We need people to be well, especially if we end up with, war on our doorstep, which of course, let's hope and pray very much that we don't. But if we do, and we have something like conscription, we need a healthy population to fight that war.
I think conscription would be a disaster, not least because I'd be rubbish at being a soldier.
Me too.
But thank you very much indeed, both to Simon Diggins, who's a defence analyst, and Matthew Hulbert.